Hi, my name is Kendall, and today we're going to be talking about Alice in Wonderland syndrome, which is also abbreviated AWS. So Alice in Wonderland syndrome is a condition involving visual and somesthetic integration. It affects about 10 to 20% of the population. And patients experience time, size, sound, and perceptual distortion, including micropsia, which is the body or objects around you getting smaller, macropsia, which is your body or objects around you getting bigger, and pelopsia, which is objects getting larger or closer to you than normal. They also can experience migraines, loss of coordination, and loss of limb control. Patients with a family history of migraines, epilepsy, depression, anxiety, stroke, and headaches with photophobia are at a higher risk of being diagnosed with Alice in Wonderland syndrome. To diagnose this, they do look at family history, but they tried to use MRI and EEG. The problem with that is that they couldn't take these tests during an episode, so there weren't any abnormal findings. Other tests can include general exams, systemic exams, ophthalmologic exams, blood counts, serum electrolytes, and biochemistry. They also had an Epstein-Barr virus serological testing that came up negative. The treatment for AWS is sodium valproate, which is abbreviated VPT. In a study of a 14-year-old boy who was presenting with signs and symptoms of AWS was put on sodium valproate at 400 milligrams once daily. After about a month, he increased the dosage to 200 milligrams 3 times daily. And at his yearly follow-up exam, they increased it to 600 milligrams once daily, and that was their final increase in dosage. The typical dosage for VPT for 12 years old and older is about 600 to 2,000 milligrams daily. And there are other medications you can take, like migraine medication, such as NSAIDs or nortriptyline. And management is pretty much going through different types of therapies, or just changing your diet. And to change your diet in ways of drinking only water, eating good carbs such as oats, quinoa, and sweet potatoes, eating good proteins such as lentils, eggs, beans, quinoa again, and good fats like avocados, chia seeds, and nuts. They say to stay away from alcohol, any aged cheeses, caffeine, sugary drinks, and chocolate, but they did say that dark chocolate is okay. So going through different types of therapy, psychoeducation gives information to the patients about their causes, symptoms, prognosis, and treatment of their diagnosed mental health disorder. Relaxation training is activities that help promote relaxation, calmness. It decreases pain and anxiety, stress, and anger. And cognitive behavior therapy treats the problems and boosts happiness. So it identifies their harmful thoughts, assess whether it is an accurate depiction of reality, and if not, then it employs a strategy to challenge and overcome these thoughts. For more information on AWS, you can visit this website. It has a lot of different signs and symptoms, how they would diagnose, and how to treat it. Okay, thank you.